My mom says it in Spanish, and I know there's something similar in English. The road to hell is paved with good intentions. And that's because people want to do the right thing. And I think what your organization represents is doing the right thing. At some point in the future, we will have legalized marijuana throughout the country. But it has to be done in a thoughtful, in a heartfelt way, understanding who is actually in control. Because what we're seeing now, I know who's in control of this. It's my ex-boss. I used to work for Southern Wine and Spirits, the largest liquor distributor in the world. Ted Simpkins, the guy who ran Southern Wine and Spirits, understands distribution networks. And that's why they're understanding that, you know, there's going to be like there used to be when I grew up in South Central LA in the 80s, liquor stores in every corner. I mean, we see in Denver what it's done. You don't see them in the affluent cities. You see them in the suburbs, in the urban settings of Denver, Colorado. The kids that are actually being busted are Latinos and African Americans because as it's already legal in California for medical, it's pretty clear that if you want to access it, it's very easy to get. What they're trying to say, what you're trying to do is to get $1 billion worth of tax revenue, how many tons of marijuana has to be brought to the state and how many new consumers? We know who those new consumers are going to be targeted and the marketing machine that's going to be built to ensure that you guys meet your targets.
That brings up the issue of child safety, and you can address the economics if you wish, Karen, but child safety has been a big issue, that there will clearly be a target market, that there will be product lying around the house and available, that there are those very attractive gummy bears and miscellaneous edibles. What will we do to address that in this bill?
Sure. So California has the advantage of coming after 4 other states that have moved first, and it learned from what those states have done. And in a few cases, such as regulating edibles in Colorado, they didn't get things right away. So, for example, there could be a package where a person eats a whole cookie and it's got 10 servings in them, and they end up getting much more intoxicated than they intend. And I don't think there was as much intense packaging as there could have been initially. They've changed that in Colorado. Here in California, none of the edible products could be made in a way that's particularly attractive to minors. There would be packaging and labeling restrictions as well, and all kinds of warnings along it. I went to both Washington and Colorado to see how their laws were working, and in Washington state they had a similar provision to what they have here in California, which says that every product can't be attractive to minors. So for example, we went to a edible product place, and you couldn't open these products without scissors, and they said the colors were kind of this puke orange because they said that the bright colors were too attractive to minors. So there have been a lot of things that have been done to make it less attractive. There's also limitations on advertising. You can't advertise in anywhere that's near a school or on highways. And like I said, 60% of all of the money after a couple of initial allocations would go to investment in education and prevention for teens treatment. I mean, if you don't trust Sacramento, we already all pay a lot of taxes for a lot of things to Sacramento. And this would specifically list where the taxes go. 60% of it is for that. There's a good chunk of it for communities that have been hard hit by the drug war. So that there will be investment in jobs training, mental health, reentry, all kinds of services. You mention a lot of complaints and say that it's written by big business. That's not the case. There was a blue ribbon commission that was set up by the lieutenant governor with public health experts all over the place that were involved in drafting this. They looked at what the legislature passed for medical marijuana, which involved input from law enforcement organizations and others. It's largely based on that. If you look at it, there's a limitation on how large any grower can be for the first until 2023, and then it's just a possibility. I haven't heard of any specific thing that supposedly, enriches somebody or is wrong with it. If you look at the language, I challenge you to hear what exactly is problematic about it.
On the subject of safety, Luis, what can we do about impaired drivers, for instance? There is no known test yet, is there? You can't blow in the tube, and
there's a reason. We want to talk about safety. One thing is what you do to control your environment and your safety, but when you're driving, you're at the exposure of everybody else on the highway. And what we know is that the AAA, the California Police Chiefs Association, the Highway Patrol, are all against this proposition because it does two things that they're saying. Number one, there is no clear way of testing when somebody is under the influence, like we do with alcohol right now, where you could just do a breathalyzer test and immediately you know if there's some reason to continue the investigation. Because there isn't a system right now, the police officers, to ensure that the liberties of the people that are stopping are not violated, they have to go into an extended process which may take hours, but because they have a fiduciary responsibility to the common public, they have to go through that process to ensure that they are taken off the road if they feel that they are a danger to the other drivers. And what that does, instead of doing like in the alcohol arrest where it may take 2 hours to do the process, this may take 4 to 5 hours for a police officer off the streets to ensure that somebody who's driving under the influence or may be investigated for that is processed correctly without violating their civil liberties. So what police chiefs are saying is, if all our police officers are going to be vested, spending time to make sure that they're investigating all this new product that's going to be hitting the streets, that's going to take police officers from responding to every other call that's out there.
With that $1 billion coming to Sacramento, couldn't they slide it into Silicon Valley and come up with a way to test for the presence of THC in the system?
That is, in fact, one of the things that's included in the laws. Additional training for law enforcement and best practices for how to test to see if somebody's impaired by marijuana. And some of that can be used for grants for something like that. Unfortunate thing with marijuana, we are used to thinking of alcohol with a breathalyzer, and it's so easy because they have a magic number, and you can be relatively confident that somebody's used alcohol pretty recently and they're probably drunk at a certain level. But with marijuana, it's very different because the way your body metabolizes THC means it can be in your system for 30 days. And at the levels that some states have, 5 nanograms per milliliter is what a couple states have set, a person could have slept for, it could be days later and they could still have that much marijuana in their system. So there's no number that corresponds with impairment, and AAA themselves don't support having a set number for impairment because it's not logical, and you end up with a number that it actually doesn't catch some impaired people, and then it catches lots of people that might be medical patients. So with driving, we already admit marijuana is readily available here. People are already driving. What this would do is actually provide more funding so that law enforcement can catch people who are impaired. You can have a test be one piece of evidence. So maybe you could have like a roadside test and say they used marijuana recently, and that could help, and then you look at that and all of the their evidence put together.
Or just check their playlist.
But the reality is my background, I understand you're a JD, you're an attorney. My background's in risk management. In risk management, we deal with mathematicians. We deal with understanding what the propensity of a peril is going to be able to be injected into a condition or a situation. And when you are adding literally tons and tons of marijuana to the California distribution system, you can try to legislate who buys it, but you can't control who's going to purchase it. And what we're saying is we know where the marketing machine is aimed at. It's aimed at the urban settings. And what we're saying is, when so much marijuana is brought into California, to hit that $1 billion mark, how much do you have to sell? How much do you have to sell? And who's going to actually be buying it? And the reality is, let's be frank, it's going to impair the way that California young people who are going to be attracted to it are going to, like you mentioned, it stays in your system because it sticks to your fat, right? It sticks to your fat. And where in your body do you have the most fat? It's in your brain. And that's why we're seeing those babies in Denver being born, and pediatricians trying to figure out how are we going to treat them. What's $1 billion is not going to mitigate. I mean, we're trying to figure out Zika and how it's damaging babies. This situation is brand new. I didn't know about it until about a week or two ago, and now it's a question that people are going to have to figure it out.
You mentioned diverting law enforcement personnel and resources, and that would be a problem. What do you say to the argument that eliminating black market sales and legalizing marijuana would, in fact, free up a lot of law enforcement personnel for other issues.
Two words: supply and demand. So when you have a legal entity who has to pay taxes, has to pay fees, has to pay the legal aspects of selling in the brick and mortar or distribution, whatever way you have it, you have incurred higher cost. That's an attraction when you have a higher market for somebody to come and low cut the legal entities. So if you're selling it at $100 an ounce for the sake of argument, and making 20% profit, for a legal operation to come, they can spend $20 and get 80% profit. And that's exactly what we saw on 60 Minutes on Sunday was happening in Denver, Colorado, where they're doing, all the police officers are going out there because there's a black market that is making a killing off of the markets in Colorado right now.
In Prohibition, when it ended, bootleggers didn't thrive. The pros
Right.
took over the business.
But that's, I think it's truly the wrong argument to have, because at the end of the day, we're not discussing alcohol. If that's what we want to discuss, then we should have
We're discussing prohibition and the
okay.
effect on the market.
So there's a question of how much usage. In Prohibition, it was readily, everybody was drinking it, and then all of a sudden it was stopped. Here in California, what we're talking about is expanding markets that are already in existence with a new consumer base.
If I may, in Colorado, I talked to the head of marijuana regulation and control there about this issue of there is some cultivation that's being exported, but it's to other states where marijuana is still illegal. Reports have shown that about 70% of the entire market for marijuana has converted to the legal regulated market now. The remaining 30% or so is people that are growing a little extra and selling it on the side. So it's not enriching cartels like it once was. The idea that you'll be able to have people grow marijuana illegally and undercut the legal regulated market is just not the case. Rand and others have estimated that the price of marijuana will go down considerably. The reason it's selling for so much money on the legal market is because of the risks of illegality. You could not possibly outcompete a legal regulated grower by growing it illegally and selling it within the state.
Is this something, Karen, really that should be regulated state by state, or should we have left this to the feds?
Well, if we left it to the feds, we wouldn't have medical marijuana anywhere. I mean, you can wait forever for the federal government to work on this, and they won't. So what is going on now is unjust, it's illogical, it doesn't work, it's wasteful, it's depriving us of tax revenue, and all of that will continue to be the case until states act. States actually went first on prohibiting marijuana. They had passed marijuana in California more than 100 years ago, long before the federal government did. So we got ourselves into this mess, and the states are getting us out of this mess. Now we have 25 states with medical marijuana, and the federal government, even Congress, or Republican Congress, has said, we're not going to enforce our own laws, we're going to keep our hands off of that. And I expect we'll say the same thing we already do with the Department of Justice, saying we're not going to interfere in the states. And really, you know, we are a federalist system of government. States regulate alcohol for the most part. So it makes sense to have the states regulate a lot of things about marijuana, and then they can serve as a laboratory of democracy and see what works best for one state, what fits with the community here. There are some things that should be a federal concern at some point, though. For example, does it really make sense for 50 different states to figure out what pesticides can legally be used on marijuana? You know, things like that. But other questions, how many stores do we want, how many different kinds of licenses, it makes sense to have it at the state level.
You are both clearly so well informed, and we want to wrap it up with a few minutes from each of you now. In summation, go for their vote. You first, Luis.
Well, I think it goes back to the first issue. You know, when we look at laws, there's 17 propositions in the ballot, and all the other ones are talking about justice, are talking about promoting or elevating some part of our society without any type of risk other than ideological. Here what we have is a proposition that actually, although, like you mentioned, it's a laboratory for democracy, this laboratory is not built or equipped at this moment with Prop 64 language, because we know that the marketing will be done to the urban settings. It's going to be marketed to the Latinos and African Americans, and it's built by profiteers who are going to make a ton of money. And the $1 billion that you guys are promising that are going to go through Sacramento and come back, we already know it's not going to happen in the way that you guys are saying it's going to happen. There's going to be people that are going to be suffering, from babies, from students, and from people and adults who are not going to be using the product like you wish or you hope it actually does. And there are going to be people that are going to be suffering. And at one point we have to ask ourselves, if we're going to bring a law to our society, it should be done correctly. I think you guys did it wrong. And I think at one point you guys are going to come back and do it right. But at this time, Prop 64 is not the right thing for California.
Can you